and we knew something was coming, but we didn't anticipate this, not this level. The death call just came on like a tsunami. I mean, it was just kind of left us just overwhelmed almost instantly.
New York, a city torn apart by the raging coronavirus, quickly became the epicenter of the disease. Famously known for being congested, close-knitted, and densely packed, especially in the immigrant enclaves, many New Yorkers were inescapable from a virus which typically transmits from person to person. While hospitalization rates are flattening out as we speak, the death toll continues to climb. With a population of 19.4 million people, the top three boroughs severely impacted are Queens, Brooklyn, and the Bronx. Places like Elmhurst, Corona, and Jackson Heights have been the hardest hit in the borough of Queens. West Indian enclaves such as Jamaica, Richmond Hill, and Ozone Park continue to see astronomical death rates. To give us an exact picture of the scope of the impact on the West Indian community, I spoke with funeral director at the Leo Kearns Funeral Home, which has 3 locations in Queens.
I know we're in Queens, so obviously, in South Richmond Hill, so we are going to serve a higher, kind of West Indian population. But as far as the cases are, what we're seeing is it's predominantly coming from communities of color. The West Indian community seems to be hit very hard. The Filipino community up in Elmhurst, in those areas, has been hit very hard. And the African American community we're seeing from like Hollis and parts of Brooklyn and has been hit very hard. And to me, it seems disproportionate. We should be seeing a wider demographic of people, but we're not. And I'm not sure why that is. I think a lot of it probably comes down to access to health care. And in Queens, in South Queens, where a lot of families don't have the luxury to work from home. They're still working in the service industry. They're still taking the bus. They're still out working. So their exposure rate is higher. It's a real luxury to be able to work from home. And to self-isolate in a large house. But our families here in South Queens, they're self-isolating with multi-generations in a household. Some of that household is still working if they're lucky. It definitely is not hit all groups equally by any stretch. I think the numbers are higher than we're looking at. This, when we read about this coming out of China, it was that it only affected elderly. But what we've seen here in New York is that that's not the case. I think I've had more people in their 50s and 60s than I've had in their 70s and 80s, a lot more. Which means the responsibility for those funerals is falling on 25 to 30-year-olds.
Kearns said that since between the end of March and the beginning of April, when the city was under siege and calls to 911 had reached a record-breaking high of 6,000 calls per day, he has had hundreds of families call his funeral service for help. The most affected are in the Guyanese, Trinidadian, and Jamaican enclaves.
The death call just came on like a tsunami. I mean, it was just kind of left us just overwhelmed almost instantly. We get phone calls from people that had called 30 different funeral homes before they were able to find someone to help. So people were desperate for help. So since this started, I've had 1,300 families call looking for funeral services. In 8 weeks. The first confirmed COVID case we had was March 18th. But that woman's husband actually died a month earlier of what was the same thing, just not recorded. So, some personal evidence that we had it here longer than we realized. March 18th, our first confirmed COVID death was funeral number 106 for us for the year. And right now, as of today, I think we had done 408 funerals.
Wow.
Yeah.
So that's an additional 300 in a space of
8 weeks. Yeah. I purchased the refrigerated shipping container so that we would have our own morgue. So, so that we could help more people take more cases on, because very quickly we were overwhelmed with cases in the building. We had previously only had refrigeration for 2 bodies, so that obviously wasn't going to be enough. So
And how many you have now?
probably in our care, usually between 40 to 50 in
Wow.
our care right now.
Kearns, a native of Queens who has been a funeral director for the past 25 years, said he has always had a connection to the West Indian community and has always been able to deliver and help families in their greatest time of need. However, the coronavirus has brought with it a situation whereby he felt helpless on many occasions. And while he couldn't help everyone due to being overwhelmed, he went above and beyond for hundreds of families. According to the U.S. American Community Survey figures, there are more than 140,000 Guyanese immigrants living in New York, making them the 5th largest foreign population in the city. The Kearns Funeral Home has been in the family for 4 generations and is one of the very few that has maintained full funeral service where the deceased were presented for viewing to relatives, just as would be the case in normal circumstances.
The Guyanese community is certainly known for large families, and to have to tell a family that they can limit, or that only 4 people can go to the crematory is very difficult, but that's to have to go through a death at this time because of that, without the ability to embrace, without, trying to decide who gets to come, when you have a large family and you're limited to 10 people, who do you tell can't come? How do you draw that line? How do you, how do you decide on that? We try to accommodate as much as we can. So we'll, instead of just saying it's the same 10 people, we'll allow, different family members to take turns. But it's not the same.
Yeah.
And some of these folks, there should be 200 people here. Not 10 people. They're well-known people in the community. They're loved people in the community, and if this was any other time, there'd be 200 or 300 people here. It's a difficult process. It's very, very emotional for a lot of people now. Especially a lot of the COVID deaths have involved a long hospital stay where the family couldn't see them, can't visit them in the hospital. So the last time that people saw them was when the ambulance took you away, and then they were in the hospital for 2 or 3 weeks, and then they died in the hospital without ever being visited by anyone. And the thought of then telling that family that they couldn't see them one last time, just didn't seem like that was right. That we needed to find a way to give them that opportunity.
While the Kearns Funeral Home has been an exception to keeping the grieving process as normal as possible, many other families in New York have had to grieve from a distance. Thousands have had no service held for their loved ones and were restricted to watching their relatives buried while sitting a good distance away in their cars. And while many were unprepared in this state of emergency, there were still some small victories.
Yeah, there was, I got a call from a young woman in, I think she was calling, actually she from South Ozone Park, she turned out to be. Her father was up in the Bronx in a hospital, and he had been dead for about 2 weeks before they were notified. She had been a little estranged from her father, and so by the time they were notified, they had already filed the paperwork for him to be buried on Hart Island, and the permit was issued. And that, you know, when the city decided that they were going to do that after, I think it was 6 days or 7 days, I think it was 6 days, that they would bury anyone who was unclaimed for 6 days at Hart Island. When they made that decision was when I made the decision to get the refrigeration unit, and then it was soon after that this young woman called, and so we were able to, you know, and I was on the phone with her, and she was frantic about, you know, that it had been this time period, and we quick looked him up on the computer. All the death certificates are filed electronically. It's a cloud-based system, so. And we pulled up his death certificate and saw that a permit was already issued for a burial on Hart Island. So we called up to the hospital quick and confirmed, no, he's still there. And we were able to send somebody up to the hospital to get him, you know, before he was sent to Hart Island. And so that was, you know, sometimes like a small victory, you know, just feeling like, you know, we can't stop them all, but, you know, if we can stop 1, 2, you know, whatever we can do, you know, every small victory counts, you know.
The streets of New York are still somewhat desolate as millions continue to stay shuttered indoors. The pause directive and social distancing has slowed the rate of infection, but officials are still cautious, looking at the numbers on a day-to-day basis. But how did New York get here?
And it is shocking to me that so many months, so many weeks, we talked about the virus was coming from China. Now it turns out the virus didn't come to the East Coast from China. It came from Europe. And all those talking heads, that is a relatively new fact. And then we still have John F. Kennedy Airport open in New York as what's called the quote-unquote funnel airports. There are about 4 airports in the nation that were left open, 4 flights coming from China and Europe. And John F. Kennedy Airport, which is our main international airport, was one of them. When you look back, November to April is a long period of time. And what happened, apparently, is the virus got on a plane from China. Someone who was infected got on a plane and went to Europe, and then from Europe, the virus mutated in Europe and then flew to New York City, Newark Airport, flew to places on the East Coast, flew to Chicago. And you can see why, right? The virus wasn't going to stay in China and wait for us to deal with it in China. Everybody talks about how mobile people are and global interconnections, etc. And that's what happened. But nobody was saying, beware of people coming from Europe. We weren't testing people coming from Europe. We weren't telling anyone at the time, if you have a European visitor or a European guest, make sure they get tested. They walk right through the airport. Well, I understand what happened in retrospect, but we have to make sure it doesn't happen again. From December to March, 3 million Europeans came through our airports. You wonder why we have such a high infection rate. We put 3 million Europeans coming into this market undetected. You don't tell anyone, there's no precautions, there's no testing, and then you let people circulate in this dense environment, you're going to have the virus spread.
John F. Kennedy, located in Queens, now seems to be frozen in time. Known to be a city by itself, as the fifth largest airport in America, as New York is the sixth most visited city in the world, now has an eerie feel and an echo of silence. Deserted corridors and terminals and empty planes speak of the sharp reduction in demand. According to a statement from the Airlines for America, passenger travel is down by 97%, equating to a customer level not seen since 1954. Airlines have parked 2,400 aircraft, and they are burning through cash at a rapid rate, some 10 to 12 million a month, as cancellations far outpace new bookings.
Here at Terminal 4, on any normal day, there would be hundreds of passengers destined for the Caribbean islands and Guyana and Suriname to the south. However, as you can see, there is no hustle and bustle here. There is a snail pace of activity in some parts of the other terminals. Meanwhile, according to reports coming out of Guyana, there are more than 10,000 Guyanese stranded here on US soil, majority of whom are here in New York and New Jersey, and some in Miami, Florida.
The death toll in New York is now greater than 27,000, according to the Johns Hopkins Coronavirus Resource Center.
On the Johns Hopkins dashboard, you're getting all the statistics for the entire world being updated as the countries release them. Now, for the United States, it's according to how the states release the numbers. So if we come down to New York and we check the numbers here, we can just get into Queens, and we can see that so far the total number of cases is actually 58,574. with the deaths being 4,750. If we go over to Brooklyn, here in Brooklyn we'll see the number of cases is 51,931. So it's actually less cases, and the deaths are 4,847. They have less cases but more deaths. Brooklyn has now surpassed Queens in the number of deaths. So let's go back here. Queens has more confirmed cases and less deaths, 4,750, and Brooklyn is 4,847. So now if we go up to the Bronx, we're going to see that the total confirmed cases is 43,251, with the deaths being 3,369. And if we click on this graph here, we can see the entire statistics here for Queens, broken down by the population, race, and age, and so forth. And you have all the healthcare facts are here, so we can see that the total number of deaths so far for the state of New York is 28,232. So with 28,232 deaths, what has the statistics been like for the burial? Let's go over to Patrick and find out.
And then for the city, it was on May 1st was 15,000 burial permits in 2019, and that was a pretty steady trend. You know, 2018 would have been very similar at 15,000 burial permits, and 2017 would have been very similar, about 15,000. So it would be safe to say that we should have been 15,000 at May 1st this year, but we were 40,000.
Wow.
Yeah.
And no doubt this unprecedented volume of work is taking a toll on Kearns and his staff.
It's all definitely shaken us. There's no doubt that we're broken after this. There's no I have one young director who spends most of his days just going to hospitals and transferring people, and he's been in every hospital in the city. Probably he's been in all these trailers, and I worry about him. I mean, there'll definitely be funeral directors will definitely go through some level of PTSD when this is over. I have one staff member that spends about 70 hours a week, and all he does is dress and casket the bodies. He's been here toiling away, you know,
Yeah.
dressing bodies, putting them in the caskets. I fell inside when I was inside our refrigeration unit. I was had stepped up onto one of the levels to kind of help adjust someone, and when I stepped backwards, I thought I had just a short step to the ground, but I had a much larger step to the ground, so I basically fell
Wow.
backwards and hit my head, and which knocked me out, not for long, but so that was the only day off I've had in the last 8 weeks. Otherwise every day has been, from 7:30 in the morning till 10 o'clock at night.
With this special report from Queens, New York, I'm Jennifer Jabbar.